Hello and welcome to Health Matters with Marcy. January is Cervical Cancer Screening Month. So today we're going to be talking about cervical cancer and how you get screened for that. Cervical cancer is a very important issue for most women, mainly age 30 and over. However, it can affect younger women. So what should you do to protect yourself against cervical cancer? The best thing you can do is to be screened for it. So how do we screen for cervical cancer? It's very simple. You go to your doctor and you ask to have a gynecologic exam. Your doctor will know to screen you for any kind of diseases, abnormalities, or HPV. HPV is the precursor to cervical cancer. What is HPV? Human papillomavirus. It affects over 80% of women. We're exposed to viruses every day. And if you know anything about viruses, you know that they come and they go. Sometimes they need to be treated, and other times they just will go away on their own as your immune system will fight them. So which strands of HPV do we have to be worried about? Because let's face it, there are lots of strands of HPV. HPV can be shown as low risk or high risk. Low risk HPV causes such things as genital warts. And believe it or not, they are not a precursor to cervical cancer. However, the high risk HPV 16 and 18 are a precancer risk. So, when you go to have your pap smear, if you are a woman aged 30 or over, you are at a greater risk of developing HPV that will not resolve on its own. So be sure to have your doctor check if you are sexually active. So when should women start to be tested or have a pap smear? New guidelines show that any woman aged 21 or over should be tested and have regular pap smear screenings. In the past, pap smears were given to women every year. However, new guidelines have come out and now those guidelines have changed. So if you never have an abnormal pap smear, you can be tested every 3 years. If you do have an abnormal pap smear, your doctor will recommend that you have follow-up testing. Depending on what is found in your pap smear, that testing could be 3 months, 6 months, or a year. What can you do to prevent HPV? Now we have a vaccine for the younger generation to help prevent the spread of this rampant virus. It is called Gardasil. You can talk to your healthcare professional about being vaccinated against HPV, which will in turn lower your risk for cervical cancer. So who should be given this vaccination and when? Any girl or boy age 9 or up could be given the Gardasil vaccination, regardless of sexual activity, previous HPV exposure, or any abnormal pap. There has been no evidence to show that there is a need to get the immunization if you are over 19 to 23 years old. So it's very important to have your children vaccinated against this at the appropriate age. If you are a lady who is 65 years or older and you have never had an abnormal pap in the past 3 tests, which may be the last 3 years or so, you no longer have to have a pap smear. If you are at risk for any kind of disease or infection, or you have family history of any kind of cancers, you should still be tested. If you are a woman who has had a total hysterectomy, you no longer need a pap smear yearly unless you had the hysterectomy due to cervical cancer. The important thing to remember is that cervical cancer can be detected and treated at an early stage if you have proper screening. Thank you for your time today, and I hope this has been very informative for you. And until next time, remember, stay healthy.